Thank you so much, Michael. It's very good to see you. And I want to thank you and the Planning Committee for this opportunity and obviously pay tribute to Paul Torrens and that legacy, which means so much in public health. Acknowledge Jonathan Fielding, a friend and mentor in public health, and just let you know how pleased I am to have this opportunity. The murder of Nipsey Hussle has really been on my mind lately, in part because it's just another example of how ridiculous this tragedy of gun violence is in the United States, but also because it professionally challenges me yet again. It makes me sad for what we haven't done. So this is a great opportunity to dialogue with, I love my panelists and my co-panelists and their work because of the dedication and the possibilities. So with that opening, let me just share some of the thinking that I have most recently on this issue. Yes, it has been 40 years. It was January of 1978 for me that an emergency room experience at the Brigham Hospital when a young man told me not to go to bed because he was going to go out and fight and cut the guy who had cut him. When that occurred, it started me thinking about this problem. And I had gone to medical school to serve urban adolescents. And it seemed, as I learned that the leading cause of death for young Black men was homicide, that this leading cause of death for a population I planned to serve had not even been addressed. And not only that, we were stitching them up and sending them out as if there were nothing we could do about it and as if it were somehow inevitable or just the way things were. So that night for me was a transition. I was a third-year medical student and I had been charged with taking care of him, with putting in stitches. And as he left, I almost immediately realized, because he said to us, don't go to bed, because I'm going to go out here and I'm going to get the SOB who did this to me. And as he said that and left, because we laughed with him, he said it with this bravado, I realized that had he made a suicide attempt and joked with us about going out and taking some more pills, we would have had a response. In fact, the protocol would have required us to even ask about his intentions, not wait on him to volunteer those intentions. So the more I started thinking about it, the more, I guess, angry, really, I became and a little agitated because here I was planning to serve a group of people and I had no idea what to do about that leading cause of death. And fortunately, I met Mark Rosenberg at CDC and Howard Spivak in Boston and Larry Cohen in Contra Costa County, and over time really helped develop this cadre of people saying, you know what, violence is a public health problem and we should be engaged in prevention. Interestingly, despite the fact that we've been at it for 40 years, and we do have some lower homicide rates, as you can see in that red line, it's nothing compared to that blue line, which is motor vehicle accidents. And I'm challenged as a professional, but also with us as a society, as to how little impact we have had on gun deaths, given what we can do and have done in other situations, including motor vehicle accidents. It is clear that despite the decline, and you've heard people say this is some of the lower homicide rates that we've had as a country, it also appears that there's a little bit of an uptick at the end of that red arrow. So I think we have to talk about that a little bit, and I think our next speakers will have a bit to say about what's going on now. Looking at violence as a public health problem, and despite the lack of success compared to motor vehicle accidents, I think we've made a major contribution in public health over time addressing this problem. What's really been helpful for me is the argument that we made at the beginning and continue to make that this is a health problem because of the magnitude, because of the characteristics. And that really surprised me because most of the violence that I saw on news at that time was about stranger bad guy violence. So I learned through the data that acquaintance and family and associate and friend violence, even with assaults and certainly with homicides, especially if a woman was the victim, that those characteristics of violence really meant that the police could only do so much, and much of what they were going to do was after the fact. The contact, I mentioned my emergency room experience, but as we started talking around, whether it was oral surgeons and dental assistants or OBGYN physicians or nurse practitioners or visiting nurses, it was pretty much ubiquitous in the health profession to have contact with victims and perpetrators of this thing called violence. Then, 40 years ago, we started saying that public health strategies, what we've used to reduce smoking or address drunk driving, would work on this issue. And it was an assumption then. But I think what has happened over time, whether it's the study of Big Brother, Big Sister, or some of the meta-analysis of classroom education, or even what cities have done, it's become very clear that we can do something about this problem. And so even that assumption that we made 35, 40 years ago has proven to be helpful and proven to be something that we should continue to do. The basic upfront, in the thick, and after the fact, primary, secondary, and tertiary prevention in public health, I've found helpful over time. Because rather than create turf issues, it helps us understand the role that each of us can play in the continuation or the spectrum or the comprehensive approach. And by that, I mean, I remember being in a setting where I was talking about our classroom work, our violence prevention curriculum, and someone said to me, well, how do you expect a gang member who shot somebody to respond to a classroom anger management curriculum? And it clicked for me that that's not an upfront situation. A gang member who has been involved in a shooting may require some education and upfront, but really is after the fact and requires a different kind of strategy. Those kids in the thick, and upfront, in the thick, and after the fact came from some teenagers in Philadelphia when I was explaining primary, secondary, tertiary prevention, and they said, no, this is this is the way to describe that. So I use that. But if we think about up front, I think that's where public health has had substantial contributions. You can think about after the fact as the role of criminal justice, both, illustrated in the white and the gold color there. I think it's in the thick where, as a society, we still fail. We still have work to do. We're not quite responding to those kids who watch their mother beaten over the weekend, or those kids who are getting expelled from school over and over again, or the kids out on the corner at 2 and 3 o'clock in the morning. We've got some work to do there, and I think a lot of what we have learned suggests that, again, we can do something about this problem. I mentioned the decline in homicides. Again, you can see that in this aqua colored bar or line at the bottom. The point that I want to make with this slide is that the majority of gun deaths in the United States are suicides, and that is often surprising for people. Usually about 2/3 of the gun deaths in the U.S. are suicide. So this not only shows you that decline that we talked about, but also this other surprising data for me when I started thinking about this problem, and that is the prevalence of suicide. I'm about to begin an area of study now looking at homicide and suicides among adolescents. And that is because I think there are some similarities and some characteristics that deserve our attention. There are some demographic differences that are pretty stark here. The lighter blue represents African American, deaths by homicide, and the darker blue, deaths by suicide, with African Americans on your left and whites on your right. And it's clear that among adolescents, among white adolescents, gun deaths are more likely to be suicides, and among black adolescents, gun deaths are likely to be homicides. And I think those are some cultural and other issues that we don't quite understand, but if you think about what causes depression and anger, the role of firearms, the role of alcohol and other drug use, the role of peers, the role of culture, you begin to wonder, are we looking at something very similar? A youth outreach worker once said to me, it didn't surprise me that he killed someone, talking about a teen, because he didn't care anything about himself. So I know he didn't care anything about anybody else. That struck me because not caring anything about yourself is sort of a classic sign of depression. But that's not the way we respond to that adolescent's behavior, urban, young man of color. So I think we've got some learning to do there, and that's where I hope to begin to make a contribution. We've done a lot of learning, and of course this is about guns, and I want to highlight that in the rest of my comments, but the culture of violence at the bottom for me has been the most compelling part of what I've learned over the last 40 years, and conversations about that I'm sure will emerge as well. But guns are a significant part of this, and in the late 80s, early 90s, when we were starting to look at this problem and the movement was growing, some amazing scientists, Kellerman, Garen Wintemute, started producing really good epidemiology on guns and what owning a gun meant. And these are two of the landmark studies and showing that having a gun in the home for suicide and homicide increased the risk that a family member or someone known to that family would be a victim of either. And I point that out because the early 90s, we were really working on this issue, and it was 94 that we passed the ban on assault weapons that Clinton signed. And these tragedies, some here in California, led up to that movement, that passion, that response. And we banned assault weapons. But immediately the backlash started, and the Dickey Amendment was passed in 1996. It took $2.6 million out of CDC's budget, and basically everywhere that the word firearm was mentioned, it was scratched out of the budget was eliminated there. And the words, none of the funds made available for injury prevention and control at CDC may be used to advocate or promote gun control. It squashed the research. Thank goodness for the Joyce Foundation and others who at the private level put money into this. But that backlash made, made a significant impact on the passion that we were developing. And Congress allowed the assault weapon ban to expire in 2004. So we had 10 years, and it's interesting, it doesn't necessarily look like we had fewer episodes of mass shootings, but if you look at the number of deaths per mass shooting, you might begin to see a significant difference between the period where we had the weapon ban and not. But we can't show that statistically. So there are people who say, well, it didn't matter. I won't even stop there and make a comment. Politically in the US, we have, and it does matter, and this is my next couple of points here, we have states that have higher homicide rates and higher suicide rates. And there is, and I'll show you on the next slide, a correlation with policy. But if you look at the left upper hand quadrant there, those are the states with higher homicide and higher suicide. And they are New Mexico, Kentucky, Arizona, Oklahoma, Tennessee, Alabama, Mississippi, really at the top there, Louisiana, kind of at the center top. It matters. And fortunately, the studies continue. And this is one that Kaufman published. It was a look at 3,108 counties in the US. And I love the conclusion because it matters where you live, what your policies are, and if you're next door to a state with strong policies, that can have a positive impact on your state. And so it really does make a difference. And I had become pretty sullen in my thinking on this after Newtown. I just figured we weren't going to do anything because we didn't do anything when those elementary school children were gunned down. I just took it as, you know, we're not going to do anything. But now I'm energized again. I have to say, the teenagers out of Parkland did a lot to get me going, and you know, they've had a success in Florida. It's not perfect, but I mean, this was Florida that passed a gun bill. That in and of itself is significant. Our senator is back at it, and we did it before, and we can do it again. Physicians, healthcare providers are back on the case, and despite the tragedy, I think we can have impact again. So I thank you, and I look forward to our conversation.